This is One on One. Once again, we welcome back our good friend Dennis Wilson, President and CEO, Delta Dental of New Jersey and Connecticut.
Great to be back.
It's always good to have you. Dennis, every time you're with us, we talk about oral health issues, and listen, I love my dentist. We talk about this all the time. It is so much more than dentistry. Oral health equals?
Oral health equals overall health and well-being, period. That's the way to look at it. The body starts at the mouth, and it's all connected, and there's just so much connectivity between overall systemic medical health and oral health.
And one of the things we were just talking about before we got on the air is a connection between oral health and the opioid addiction crisis, you say?
Yes, we're doing some very, very important work in there. If you hear all the stories about opioid addiction, misprescribing, overprescribing, et cetera, it's always pointed at the medical side, the physicians, hospitals, et cetera. But a few people realize that dentists prescribe opioids as well. So if you're going for a complex procedure, root canal, extraction, wisdom teeth, things of the like, chances are you're going to have some kind of pain medication or pain management program after you leave, and chances are you will walk out with a prescription for an opioid. So two very important things that we're doing. One is when one of these complex procedures is about to be done, we generally get a notice from the dentist for a pre-treatment estimate. Is the person covered? How much are they covered for? What is the benefit, et cetera?
You vet that.
We have that. So
you vet it too.
We vet it, absolutely. And there's a flag that goes up for us and say, okay, this is an opportunity for us to reach out to the member, to the patient, send them something electronically, email. If they give us other addresses, we'll send it snail mail as well. But it'll say, do you know that your dentist could prescribe you an opioid? These are what you should be looking for. These are the questions you should ask, and you should ask for any alternative medications like Tylenol, Advil, et cetera.
One of the other things you and I have talked about, Dennis, is important for patients to be advocates for themselves.
Yes, indeed.
And the more information they have, particularly from conversations like this, they need to bring these issues to the oral health professionals, the dentists and dental hygienists and others dealing with them, right?
It's their own health, it's their own well-being, and it's their children's well-being as well, because opioids are also prescribed for children in many instances. So it's very important that they be informed and ask the tough questions.
You know, the other piece of this, of dentistry / oral health connected to veterans. We're actually in your offices a while back, and we're having an in-depth conversation about this. And there's an event coming up, Smile for Our Heroes event.
Yes.
Now, it's going to be coming up, and this will be seen after as well. But what is that event, and how is it tied? We're looking at some video as well. How is this tied to your organization's commitment, the industry's commitment to veterans and their oral health?
So it's our way of saying thank you and honoring our vets. Last year was the inauguration of Smiles for Our Heroes, and it was done at Zoo Fall Health Center in Dover. We had over 200 vets that came out, 200 vets, all branches of the service, 200.
What are they dealing with, Dennis?
They're dealing with all sorts of problems, have not seen a dentist in their life or in several years, a whole stream of oral health issues and dentistry issues, many times, again, seeing a professional for the first time. So they're coming to us, and there's a real need. We've had over 140 volunteers to staff this, dentists from across the state, healthcare professionals, other staff.
It's so interesting. Someone say, oh, so someone who served our country, thank you for our service, you might have a few cavities. That's not what we're talking about. We're going well beyond that.
We're going well beyond that. Again, you know, you talked at the top of the conversation about the connection between oral health, systemic medical health. In some of these veterans, we're finding issues. They may be pre-diabetic. They may have indications of oral cancer, and then we're pointing them in a direction they need to go on the medical side.
And early detection or detection at that point is critical.
Could save
to their
lives.
treatment.
Could save lives.
Stay on this for a little bit. I know we don't talk policy and politics and public policy very much with you, but there's a lot of talk nationally, and I don't care now we do care about what's going on in Washington, but what I really mean to say is, in some ways, the politics is one thing, but the public policy associated with the Affordable Care Act,
Yes.
the, quote, individual mandate, and its connection to oral health, that's the part that I care deeply about, we do, but most importantly, I think our audience does.
Yes, and we care deeply about it as well. You know, I think Governor Murphy did a good thing in that he stepped up and preserved the pieces of the ACA, Obamacare, if you will, that really work.
That a state can do.
That a state can do. You know, the individual mandate is one of those. Maintaining a marketplace and exchange is another. Maintaining some of the subsidies that go on and get paid ultimately to the user, to the member, to the patient is another great thing. And ultimately, we've seen that medical costs for medical insurance have gone down a few ticks. And that really helps us, and it enables people to afford to buy the companion dental products. So
what do you mean?
We are on the exchange. So now people have an awareness, they have an ability.
By the way, the exchange, Jen Eichland, the exchange, can we put it up as we speak right now? Go to the exchange. Is that still healthcare.gov?
It is.
Put up healthcare.gov. I know we can put that in very quickly. That is the exchange. It hasn't changed in the last several years. Go ahead.
It really hasn't changed. It's still what has covered many New Jerseyans that have not had coverage before, both on the medical side and on the dental side.
So they can go right now.
They can go right now.
Someone says, well, it's not that period. Well, that period's coming back again, right?
It is
it's
coming back.
It's a cyclical thing.
It's a cyclical thing, right? And we're in it right now.
Okay. Before I let you go, diabetes and dentistry.
So the last time I was on the show, we spoke about a pilot program that we're quite excited about. And in a couple of urban areas, we got a couple of willing dentists that really taught us a lot in terms of the patient-dentist relationship as it relates to diabetes. So we enabled them to perform diabetes tests. Just do the test, send it away to a lab, get the results, have that transmitted to their physician. We've now initiated a statewide program for the testing of diabetes performed by a dentist. And as a matter of fact, we've embedded that benefit into all of our programs. So it's a standard benefit, everyone can get it. And the best thing is, because it's a standard benefit, it is at no additional cost.
Making a big difference.
Making a huge difference.
Dennis Wilson is the President and Chief Executive Officer of Delta Dental of New Jersey and Connecticut. Thank you for shedding important light on these critical issues, and also, again, for your support of public broadcasting.
Thank you, Steve.
We'll be right back right after this. Thank you, Dennis.
Great.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by NJIT, the New Jersey Education Association, the Northward Center, New Jersey Resources, MD Advantage Insurance Company of New Jersey, the Healthcare Foundation of New Jersey, and by Adler Aphasia Center. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.